today's episode where we'll explore a topic that is fundamental to foot health and overall movement: proper footwear and shoe anatomy. Whether you're listening to our podcast or watching the video show, we're excited to share insights that will help you and your clients achieve better foot health. Let's start by discussing why proper footwear is essential for maintaining foot health. The shoes we wear are not just fashion statements. They are crucial tools that protect our feet, support our posture, and enhance our movement. Poorly fitting shoes and shoes that are used for the wrong activity can lead to a host of problems, including bunions and general discomfort. Now let's dive into the anatomy of a shoe and how each component plays a vital role in foot health and movement. Understanding shoe anatomy helps us to make informed choices when selecting footwear for ourselves and our clients. So looking at the insole. So it is the layer inside the shoe that provides cushioning, and a well-designed insole conforms to the shape of the foot, distributing pressure evenly. For those with functional gait issues and inefficient gait mechanics, insoles can be customized to provide additional and promote better and ideal foot mechanics. So insoles can also be made from various materials, including foam, EVA, silicone, gel, cork, and even leather. So minimalistic shoe insoles allow for greater sensory feedback from the ground, which is crucial for developing proper foot mechanics and balance. They provide slight cushioning to prevent direct impact with hard surfaces, whilst maintaining the foot's natural alignment and flexibility. The midsole is the primary shock absorber of the shoe. It's usually made out of materials like EVA or ethylene vinyl acetate or polyurethane. The midsole reduces the impact on the feet, particularly when walking or running on hard surfaces like concrete, tiles, bitumen, where the foot doesn't have enough shock absorption to tolerate these two-dimensional surfaces. A thinner midsole does make the muscles in our feet work harder. So the foot is designed to adapt to three-dimensional surfaces such as the natural ground. Unfortunately, due to the fact that we live in a modern world, many of us do require extra shock absorption in this area to tolerate the harder surfaces. In minimalistic or barefoot shoes, the midsole may be thinner and definitely a lot more flexible, using materials that allow natural foot movement. So a thinner midsole in barefoot style shoes promotes better proprioception, which is the body's ability to sense its position and its movement. It also encourages the foot to engage its natural shock absorbing capabilities, reducing reliance on artificial cushioning and improving overall foot function. However, if a client actually has inefficient shock absorption, arthritis, or surgery to fuse joints like the big toe, extra cushion shoes may be required for them. The outsole or tread is the outermost layer that makes contact with the ground. It provides traction and durability. A good outsole should also be flexible enough to allow normal natural foot movement, while also being sturdy enough to protect the foot from external elements. The outsole is usually made from rubber or synthetic compounds, but in barefoot shoes it's often thinner and more flexible. Some barefoot shoes use natural rubber or even thin Vibram soles to provide protection without compromising flexibility. A thin, flexible outsole allows for natural foot movement and better grip on various surfaces, and they do make shoes and outer soles for various purposes. So for like in a trail running shoe, you've got a completely different pattern on the bottom of the foot to have a lot more traction and allow shedding of dirt and mud in between it, versus a road shoe which has a very different tread altogether. So the outer sole protects the foot from sharp objects while still enabling a natural gait and foot function. And this design encourages the foot muscles to work as they would naturally, improving strength and resilience. The upper part of the shoe holds the foot in place. It should be made of breathable materials that allow air circulation, also whilst providing a snug fit. The upper also includes laces to help in securing the shoe comfortably around the foot, which is required so that the toes actually don't have to claw whilst keeping the shoe on. So uppers can be made from synthetic materials, leather, lightweight, breathable, or even mesh and knit fabric to provide a snug fit without restricting normal movement. A lightweight and breathable upper allows for natural foot expansion and contraction during movement, reducing the risk of blisters and discomfort. It also helps to keep the foot cool and dry, which is important for preventing fungal infections and maintaining overall foot health. The heel counter is the stiff part at the back of the shoe that holds the shoe in place. So a firm heel counter prevents excessive movement of the foot within the shoe. The heel counter is typically made from plastic, thermoplastic polyurethane, or stiffened fabric. Now, in minimalistic footwear, the heel counter may be softer or really flexible or even absent to allow for greater heel flexibility. A softer or minimal heel counter supports natural heel movement and reduces the likelihood of heel strike patterns that can lead to injury. It promotes a midfoot or forefoot strike, which is more aligned with natural walking patterns. The toe box is the front part of the shoe where the toes sit. So a nice, wide, non-tapered natural shoe box allows the toes to spread naturally, reducing pressure, improving shock absorption, and preventing the formations of bunions, tailor bunions, and other toe deformities. So a toe box can be made from the same sort of material as the upper, often reinforced to provide some protection. In barefoot shoes, the toe box is typically wide and unrestrictive, allowing the toes to move naturally. A wide toe box enables the toes to splay and grip naturally, which is essential for balance and propulsion. And this design reduces the risk of developing conditions like bunions and promotes overall better foot health by allowing natural toe movement. Proper footwear doesn't just protect your feet, it also enhances your movement. So when shoes fit well and they enable the foot to function as it was designed, this means better balance, better stability, improved posture, and reduced risk of injury. So for example, on hard modern surfaces like concrete, the right shoes offer the necessary cushioning to absorb shock and protect the foot's natural structure. In contrast, walking barefoot on such surfaces for long periods of time can lead to overuse injuries due to the lack of natural shock absorption in the foot, especially if the foot is not moving as ideally as possible. Extra cushioning at the midsole. So, in a lot of modern shoes, extra cushioning can be placed on the inside part of the shoe, at the rear foot, the midfoot, and the forefoot, depending on the shoe design. While extra cushioning provides shock absorption, if it is actually put in the incorrect place at any or all of these places in the shoes, particularly on the inside part of the foot, it can prevent the foot from moving in normal gait mechanics and increase the risk of inversion sprains, ACL injuries, and falls. Now, even though these extra cushion shoes, which are really popular at the moment, provide a certain service for people that have arthritis and have issues post-surgery, the overcushioned shoes can also dull proprioception feedback, leading to less efficient movement patterns. A rocker bottom sole features a curved shape that helps in transitioning from heel strike to toe off smoothly. This design is particularly beneficial for individuals with limited mobility or foot pain, as it reduces pressure on the forefoot and can enhance gait efficiency by aiding in the forward motion during walking or running. However, in the wrong individual, it may alter natural foot mechanics, so it's typically recommended for specific conditions rather than general use. In summary, proper footwear and understanding shoe anatomy are crucial for maintaining foot health and optimizing movement. If in doubt, go with a neutral shoe. No extra cushioning or support on the medial edge of the shoe. So, whether you're recommending shoes to a client or selecting footwear for yourself, consider the role of each of the components of the shoe. Remember that good shoes do more than just protecting your feet, they enhance your overall well-being. Thank you for tuning into this episode. Be sure to check out our latest blog and post and join us next time as we continue to explore more topics related to foot health and movement. For more information, visit our website at the Stabilisation Academy, and don't forget to follow us on social media for daily tips and updates. Until next time, take care of your feet. They are the foundation to your health.